Fluoride has been a controversial topic since its introduction into public water systems more than 75 years ago. While it's well established that fluoride prevents cavities, whether the benefits outweigh any potential risks has been debated for decades, with new research on fluoride toxicity being published frequently. It's important to stay up to date on the current recommendations and guidelines. So let's talk about some of the most recent updates from 2025 in this quick review. And if you're interested in learning more, I'll provide more information below. If you're new here, welcome to the channel where we discuss topics in dentistry and help you make sense of it all. Before we dive in, I want to mention that I am not telling you to stop using fluoride completely or to avoid fluoridated water. Instead, I want to provide you with the latest evidence so that you can make an informed decision for yourself and your family based on your own risk factors and circumstances. In 2025, the US FDA issued a notice that they plan to remove all ingestible fluoride supplements from the market by late 2025. This was based on the totality of evidence indicating that fluoride may impair the gut microbiome during infancy and early childhood, which can result in adverse effects such as thyroid dysfunction and increased weight gain. Additionally, the European Food Safety Authority published their updated risk assessment on fluoride in mid-2025, setting a safe intake level at approximately 3.3 milligrams per day for individuals older than 8 years of age and pregnant women. For those of you who are already cringing, yes, that's right. You have to do the math now to figure out how much fluoride you are getting every day from all sources. It used to be easier when we could just assume that the water was fluoridated at 0.7 milligrams per liter and everything else was fine. But now, with various policies shifting, water fluoridation being banned in certain communities, and naturally occurring fluoride varying widely across different areas, it's crucial to consider multiple sources of exposure. So let's talk about some of the key developments in 2025 and what they mean for you and your family. First, it's important to understand that fluoride has both topical and systemic effects on the body. While the topical benefits are well established, there is growing evidence suggesting that high levels of systemic fluoride intake, particularly through ingestion, may lead to adverse health outcomes. So we'll talk about the benefits first, then we'll discuss the risks. As far as the topical benefits, large-scale modeling studies suggest that eliminating water fluoridation in the U.S. could increase childhood caries by roughly 7.5 percentage points and cost almost $10 billion over 5 years. So clearly, water fluoridation has significantly reduced the prevalence of dental cavities. Especially in vulnerable populations, studies show that people living in areas with fluoridated water have a lower incidence of tooth decay compared to those without access to fluoridated water. On top of that, fluoride has been shown to strengthen tooth enamel, making it more resistant to decay-causing bacteria. There is substantial evidence supporting the effectiveness of fluoride in preventing tooth decay and promoting remineralization of enamel. On the other hand, the systemic effects of fluoride are less clear and have been associated with several potential risks, including neurotoxicity, thyroid dysfunction, and skeletal fluorosis. A 2025 National Toxicology Program meta-analysis found that exposure to fluoride above 1 milligram per liter in drinking water was associated with a decline in IQ scores of approximately 3 to 5 points per 1 milligram per liter increase. Though evidence below 0.7 milligram per liter remains inconsistent, the study highlights potential risks of elevated fluoride concentrations on cognitive development. Thyroid dysfunction has also been linked to high fluoride intake. Studies show that excessive fluoride exposure can interfere with thyroid hormone synthesis and metabolism, leading to hypothyroidism. Now, how does fluoride affect bone health? Well, while fluoride can strengthen bones, excessive intake has been associated with a condition called skeletal fluorosis, characterized by bone pain, stiffness, and increased risk of fractures. A study published in 2025 found that high levels of fluoride exposure were associated with an increased risk of bone fractures, particularly in postmenopausal women. Lastly, kidney toxicity is another potential concern. Studies suggest that high levels of fluoride intake can cause kidney damage and impair renal function. This risk is particularly high in individuals with pre-existing kidney conditions, so we've covered quite a bit of ground already, haven't we? But don't worry, we're almost done. Last, but certainly not least, the microbiome. A growing body of research indicates that high fluoride concentrations can alter the composition and function of the gut microbiome, leading to potential health implications such as altered metabolism and increased inflammation. A study published in 2025 showed that prenatal fluoride exposure was associated with significant changes in the gut microbiome of offspring, which may contribute to long-term health consequences. As far as the safe upper limits go, the EFSA concluded that for individuals aged 8 and above, the safe intake level is around 3.3 milligrams per day, whereas pregnant women require a slightly lower intake of approximately 2.9 milligrams per day. These thresholds were determined based on the tolerable risk of neurotoxicity, thyroid dysfunction, and skeletal fluorosis. For infants and children under 8, the EFSA established a tolerable upper intake level of 1 milligram per day to safeguard against neurotoxicity and thyroid dysfunction. Additionally, a separate study published in 2025 investigated the relationship between fluoride consumption and the risk of cancer, specifically examining the potential impact of fluoride on genetic mutations, oxidative stress, and cellular proliferation. The findings suggested that high levels of fluoride intake might promote tumor growth and development, highlighting the importance of keeping fluoride levels within recommended limits. So now let us talk about some of the shifts we have seen in 2025 related to these findings. 2 states in the U.S., Utah and Florida, have recently passed legislation banning public water fluoridation. This move was driven by concerns over reduced IQ and bone health risks associated with fluoride consumption. Similar proposals are gaining traction in other states. The U.S. Food and Drug Administration (FDA) is taking action by removing all ingestible fluoride drug products for children from the market by late 2025. They are citing safety concerns as the reason for this decision. In light of this evolving landscape, the American Dental Association (ADA) reaffirms its position that water fluoridation at 0.7 milligram per liter remains safe and effective in preventing tooth decay. However, the ADA acknowledges the need to monitor fluoride intake from all sources and adjust recommendations accordingly. So now let's discuss some recommendations for you and your family based on the latest evidence. If you have infants and young children in your life, it is important to use only a rice grain-sized amount of toothpaste and ensure they don't swallow it. Avoid fluoride supplements unless absolutely necessary, especially if you live in an area where the water is fluoridated at 0.7 milligram per liter. Pregnant women should monitor their total fluoride intake and keep it below approximately 3.3 milligrams per day. Individuals with chronic kidney disease should monitor fluoride serum levels, especially if the water contains more than 1 milligram per liter of fluoride. Finally, for the general population, continue using topical fluoride products like toothpaste and varnishes to prevent cavities while avoiding excessive systemic ingestion. In conclusion, as dental professionals, we have a responsibility to stay updated on the latest research and recommendations regarding fluoride use. As more evidence emerges, we must continually assess the balance between its benefits and potential risks. Remember that optimal fluoride management involves a topical-first approach, prioritizing its use in forms that provide cavity protection without excessive systemic absorption. Minimizing unnecessary ingestion, especially in vulnerable populations like children, pregnant women, and those with kidney disease, is crucial. Encouraging patients to diversify their dietary sources of fluoride, considering both food and water intake, can help ensure adequate exposure without exceeding safe limits. By staying informed and adopting a balanced approach, we can provide the best possible care for our patients while considering the complexities of fluorides. Role in oral health. That's it for this video. Let me know what you think. If you found this helpful, please leave a thumbs up and share with others. And as always, thanks for watching. Until next time, take care.